Blood exposure risks can sit inside ordinary workplace tasks. The starting point is not a diagnosis or an estimate of one person's transmission risk. It is a control question: where could exposure occur, and how will prevention, reporting and response be organized before work begins? Blood-borne viruses can be transmitted through a needlestick or another sharps injury. Transmission can also occur through direct contact with broken skin, or with mucous membranes such as the mouth and eyes. Those are the exposure routes this workplace control system needs to consider. Hazard identification should consider sharps and blood splashes, laundry, medical equipment or waste, toilet cleaning, first aid, and waste duty. It should also consider potential violence or assault. These are categories for planning, not a diagnosis or a claim about any individual exposure. Before work starts, organize the approved control elements as one system. Identify where the listed hazards may arise. Decide how prevention, reporting and response will connect. Make sure the people involved can understand the safe system, the equipment, the training and the procedure that apply to their work. Blood-borne virus risks should be eliminated or minimized using the hierarchy of controls. Administrative controls and personal protective equipment supplement the higher-level controls. A procedure or a pair of gloves is not the whole system when a higher-order control can address the risk. A safe system of work should bring together standard precautions, safe sharps handling, cleaning and disinfection, waste management, and suitable personal protective equipment. It should also include worker information, training and instruction. The parts need to support one another in the actual work. Used sharps should be handled as little as possible and disposed of at the point of use. Workers should not recap, break or manipulate used sharps. They should not reach by hand for sharps in bags or crevices. This video shows those actions only as clear exclusions, never as acceptable handling. If work would require recapping, breaking, manipulating or reaching by hand for a sharp, that is a clear control failure. Stop that activity and escalate through the workplace process. Do not improvise a handling method from this generic illustration. The visual is not a site-specific procedure. A workplace exposure procedure should cover immediate first aid, prompt medical advice, incident review, and corrective action. Emergency plans should be tested, with workers trained in the relevant procedures. This is procedural guidance only, not personalized post-exposure treatment advice. Policies and procedures can organize responsibilities and evidence, while training and instruction help workers apply the system. But documents do not complete the work by themselves. Implementation, consultation, training, controls, records, and evidence are still necessary in the workplace. Monitoring should examine the effectiveness of policies, equipment, and training. It should also examine exposure investigations, post-exposure follow-up, and compliance with standard precautions. The purpose is to test the control system and identify where review or corrective action is needed. Warning signs include any gap in the approved system, unsafe sharps handling, missing control elements, a response procedure that cannot be followed, or monitoring that shows the controls are not effective. Stop and escalate the affected work through the workplace process rather than treating a generic document or diagram as proof. This education is based on approved New South Wales guidance, with jurisdiction-specific application. It is not binding law throughout Australia. It does not diagnose infection, estimate an individual's transmission risk, or provide personalized post-exposure treatment advice. Generic visuals are not a completed site procedure, treatment plan, risk assessment, training record, emergency plan or proof of compliance. No document or video guarantees absence of injury, exposure, enforcement action, audit findings or legal consequences. Get started free, https://app.bluesafeonline.com.or/register